tell us everything which one would like to know about Ayurveda. How would you explain it like in 5 minutes for someone who is like, doesn't know anything about it? What is it and how it differs from a Western allopathic medicine, since we are here in Europe?
Okay, so see, as I said, that it's a science of life where we try to help people who are sick, but we also try to maintain the health of a healthy people. Now, when we come to allopathy, is a different science. Ayurveda is a different science, and like an homeopathy is a different science. Marma therapy is a different science. Now, Ayurveda emphasizes on the personalized diagnosis and the treatment for an individual. We all are individual. We all need individual attention, individual remedies. What is given to one person, it cannot be given to the another person, even though they have the same disease by, let's say, allopathic. If somebody has psoriasis, I would give X number of medical to that person and maybe some other remedy to another person. So it's a whole individualized science, individualistic science. We all are unique, and Ayurveda believes in having three dosha concept, which is very
Yes.
unique to Ayurveda, which are known as Vata, Pitta, and Kapha. As you know, the whole planet, the whole universe is made up of 5 elements. Similarly, our body is made up of 5 elements. These 5 elements together create three physiology, which are known as a Vata, Pitta, and Kapha. If we have the harmonious balance of the Vata, Pitta, and Kapha in the body, we remain at ease. If there is an imbalance, we start to feel the sickness or disease or health challenges. So Ayurveda focus is more on that, while allopathic is a science, is a modern medical science. They go more with the reports and blood tests and CT scans and different things. While in Ayurveda, for the diagnosis, what we do the nadi pariksha. So this is the radial artery in the right hand, and so generally, for the man, we check in the right hand. For the females, we check in the left hand. So we do this nadi pariksha. Nadi is an artery, the vein. So we check this pulse consultation. So we assess the pulse, the rhythm, the rate. Then we also assess the tongue, the eyes, and the skin, the appearance of a person, and the questioning and everything. So these are the basic concept of diagnosing a person in Ayurveda. And in Ayurveda, we give medicines made from plants and herbs and minerals, while allopathic would mainly use the synthetic drugs. Now, Ayurveda is a science where there are rarely side effects, and allopathic medicines are definitely heavy on the body. Of course, it can give you short term relief. Ayurveda sometimes can take a long time, but the shorter the span, for the chronic disease, when we give the medications like corticosteroids, cortisone, or painkillers, they are heavy on your liver, your intestine, your kidneys, and ultimately, so if you try to take care of one disease through allopathic, let's say in the chronic condition mainly, and if you are given drugs that you take it for a certain period of time, possibly these drugs can have a side effects, and possibly you might start to have another pathology or another disease because of the
Yes.
medication that you took for the pre-existing condition, which was the medicine was given to you, and now you deal with some other disease. So I have seen in my practice, when patient come to me with let's say they are taking cortisone, or let's say cortisone, which is mainly used to treat for autoimmune conditions and skin conditions and the lungs, or kind of let's, even in the COVID there was an overuse of steroids. So steroids in the short term can give you a relief, but when you use it for certain period of time, then a woman would start to develop hirsutism, where there are hair growth on the chin and on the face, and it will increase the sugar in the body. Your face will become puffy, so it's like a moon face swelling will be there. The your bones will start to get less deposition of calcium, so you will start to have the the thin bones inside the body, so bones will get cracked easily, or you might have the fractures. And then also it can be heavy on the liver and the kidney. So when you are taking these steroids for a long time, your doctor would ask you to go for kidney functions and the liver function every 2 weeks or 3 weeks. While considering Ayurveda, it may be short, not that short. It can take time, but it will be much healthier option, much sustainable option, and rarely produces side effects. And by balancing the doshas, so we do not just go with the naming of the disease, but we take the individual person as a whole, and then the imbalance of doshas, and we prescribe diet modification, lifestyle modification based on their irrespective imbalances at the body. And that's how we make the person healthy as a whole and holistic body. So that's the major difference between Ayurveda and allopathic.